Good evening, everyone. I'm Dr. Nancy Stanley, physical therapist, life and health coach, and I'm here today to talk about diabetes. And it's such a popular topic, or maybe I should say unpopular topic, because it's so many people are being diagnosed with diabetes or afraid they're going to get diabetes. And I see Hugh on here, and I see your post, Hugh, and way to go. You're learning, you're educating yourself. And so tonight, I'm gonna burst some myths about diabetes. And you probably say, well, how do you know these aren't true? And here's what I'm going to tell you. I know they're not true because of the results that I have gotten with my clients. In fact, almost every one of my clients that has dropped their weight, gotten away from carbs, got in ketosis, learned what to do, has either come off of all their medicine or significantly decreased their medicine. Now, I'm not talking about type 1 diabetes, okay? It is not curable. But, well, I'll say it's not curable. There are some things on the horizon, and there's pancreas implant, different things, But I'm talking about type 2 diabetes, yeah. So keep getting these little pop-ups up here. So thank you for joining me. I want you to listen really close. I have a webinar that I would like to send you. I can post it. I actually will post it in the links, okay? Let me just post it in the links. Hey, Hazel. Okay, so I'm going to post that webinar. And in that webinar, you're going to learn why you have fat around the middle and why you have cravings. And it's all related to insulin resistance, okay? So let me start by saying this, that diabetes is promoted by the medical profession and by, or let me just say some of the medical profession, and by the American Diabetes Association, the Australian Diabetes Association, as a chronic disease. And when you say that, what you're saying is that it's just something that continues, and it's not curable, and you just have to learn how to live with it and treat the symptoms, which is what is happening, okay? The insulin that doctors and nurses and nurse practitioners give patients, and even some of the other medicines, is treating the symptom. All right, so let me get to it. I'm kind of jumping ahead. All right, but okay, so I'm going to tell you that it is not chronic. It is for some people because they're not treating it. They're treating the symptoms. But for some people, it can be cured. And I've seen it happen. I've even got a type 1 diabetic. She's lost 39 pounds, and she's taking very little insulin. She's fasting every day for 24 hours, which is amazing. And she told me, she said, I watched your program. I've got her video. If you're interested in seeing her video, if you know someone that's type 1 that's scared about doing the ketogenic diet, especially the healthy keto, which is what I teach. I don't teach regular ketosis. I teach healthy ketosis. Then message me, and I'll share that testimony. But anyway, so how do I know it can be cured? Because I've had so many clients that come off of their medicines. They get their blood sugars down really in about a week to 80s and 90s, when they were 240, just out the roof, and they were scared to death, okay? So I'm gonna be doing a series, I think, on diabetes, because I think there's so much about it that people don't know. Here's what most people know. I have it. I have diabetes, and I need medication. That's pretty much what they know. And from what my clients tell me, they had no one had ever talked to them about it being curable. All that was ever said to them was, well, let's up your medicine. Every time they would go, it's more medicine, more medicine. And so, yes, they maybe got diabetic education, but it wasn't the information that would get them the results to get them off their medicine. It may be lowered their medicine, or it may be lowered their A1C, or lowered, they lost some weight, but they really didn't cure it. Hey, Tammy, thank you for joining me. I know you're on here, and I know you're here to learn. Okay, all right, so let me just say, drugs don't really do anything for the disease, okay? And you're like, well, what do you mean they don't? Because what the drugs are doing is, all right, the drugs are addressing the symptom. All right, so let me just say this. Type 2 diabetes is too much, that should be another zero there, another O, is too much insulin resistance. So you're like, well, what is insulin resistance? I'm going to tell you that in a minute. But that's what type 2 diabetes is. Yeah, it's too much insulin resistance. And so, nobody debates that. I mean, there's no debate that insulin resistance is the reason, is what causes diabetes. So that's really the disease, is insulin resistance, which causes sugar to be in the blood. When you check your finger, your glucose level, your blood glucose level is elevated. Okay, so, but insulin resistance is just that it causes the symptom of blood sugar elevation. All right, so the treatments that we have now, the medications that we're using, are targeted at the blood sugar, but not at the disease. Does that make sense to you? No, it doesn't. And one of the doctors that I love to follow, I love to him, because he puts it out there so simply. And some of this information is what I've gleaned from him. He wrote the book The Obesity Code. He's called the Diabetic Doctor. I've seen him speak. I've followed him for several years now, and he's actually curing diabetes. Thousands, hundreds and thousands of people. He's opened up clinics. He's actually in Toronto, but he's opened up clinics around the world to let people know that you can lower your blood sugar with the ketogenic diet and intermittent fasting. Now, you got to do the two together. You can't just do ketogenic. You got to do the fasting. And there's so many benefits to that. So I'm going to talk about that over the next few days. I'm going to talk about what ketosis is, and how to get into ketosis, and how to do intermittent fasting. So, but the right way. All right. So, okay. So does this make sense to you? If you had an infection, if I had an infection on my hand right here, okay, and I know that the infection is there. And I went to the doctor, and I said, I've had some fever too. And he said, well, let me give you some Tylenol for that fever, and we'll get that fever down. But he didn't treat the infection. I would think he was a quack. I would like, okay, but you didn't do anything about this. Okay, so, but if he gave me an antibiotic and said, I'm going to give you something for the symptoms, the fever, but I'm also going to give you an antibiotic. It's kind of even like an alcoholic. You wouldn't give an alcoholic more alcohol, but that's what we're doing with the diabetic. They've got too much insulin anyway. They're producing too much insulin based on what they're taking in with their nutrition. And so we say, well, let me just give you some more. And every time you go back, it's more and more and more. Yeah. And so, and I see you, Lorianne. Yeah, your grandmother became afterwards. I believe in this diet. I've seen great results. Yes. So just think about it. The way to get rid of insulin resistance is to get sugar out of the blood. It just makes sense. And so you have to ask the question, why would you just give more insulin when insulin is a fat storing hormone? And so that brings me to this. You see my two little friends here. This is how much blood, or approximately how much blood is in your body. So that's why the red dye. And so if I were to prick your finger and your blood sugar be 80 or 90, you would have you would have about a teaspoon. That's about a teaspoon of blood. I'm trying to break it down really simple. A teaspoon of sugar in your blood. Sorry. Okay. The average American is eating 36 or more teaspoons a day. So you think, well, gosh, what? That's why their blood sugar is elevated. But if your pancreas is working right and you haven't been doing this for a long time, then it's going to break it down. But what it does is going to take that extra and store it. It's kind of like I have a storage building out here, and what's in there is what is the overflow from the house. Okay, and so what your body does is kind of like a bear when they eat all the berries and then they go into hibernation. They store that fat, and when they don't take anything in, they burn that fat. So when they come out of hibernation, they're skinny, right? And that's what you'll be when you get into ketosis and quit putting sugar in your body. I mean, it's not rocket science, okay? But it's not something that's very popular by the pharmacology industry because people are dependent on these drugs because they don't know the real treatment. All right, so what happens, your body works, I mean, it does what it's supposed to do. It stores that sugar as fat to use later, okay? But you don't need, and so it's there. So what I tell my clients when we're fasting, I'm like, okay, when you first start your fasting, you're going to hear a little rumble in your stomach, but you're not going to be hungry. It's just that rumbling because your stomach's used to digesting food all day long, and it never should do that. Our bodies were never created to digest food all day long, okay? I don't think in biblical times they got up and ate a sausage biscuit for breakfast. They probably got up and didn't eat anything, okay? But I tell them, I'm like, reach down and grab that roll of fat. That's your meal. And your body will eat it as long as you're not putting in more carbs. And I'm getting into another subject, and because I'm so passionate about this, because when you have a person tell you that they have more energy, they feel better than they ever have, they're sleeping better, they're taking less insulin than they ever have, they have more energy, their brain fog is gone, that's something to get excited about, okay? So I'm going to flip over here and talk about, just give you one more little brief explanation of what insulin resistance is, okay? It's when the cells in your muscles, in your fat, and in your liver don't respond well to insulin and can't easily take it up. Now, why would that happen? That would happen because you've given it too much with all the carbs. And, diabetes, the incidence of diabetes skyrocketed in the early 80s. And that's when people, the whole cereal and sugared Cokes and just so many things that we weren't used to eating, wraps and sandwiches, hamburgers and French fries and all these things that are carbs that cause your body to produce insulin. And the cell gets eventually where it closes, it doesn't open to the insulin, and so your fat is stored. Okay, so and what happens is the pancreas makes more insulin to help. So how to know? Here's how you can know some of the signs of insulin resistance. These are just some; they're not all. Well, one is you're obese. All right, if you go on that BMI scale and you put in your numbers, you're gonna there's a level that says obesity. So if you're obese, that's one of the symptoms of insulin resistance. And I'll have people tell me all the time, well, my doctor says I'm not diabetic. Well, it's just relative. If you've got fat around the middle and you're obese, you might as well say you're diabetic because you're insulin resistant. Diabetes is insulin resistance, okay? All right, you got a waist over 40. If you measure around the waist, it's over 40. Your blood pressure is 130 over 80 or higher. Your fasting glucose is 100 or greater, fasting glucose now. Your fasting triglycerides are 150. Your HDL is under 40 if you're a male or over 50 if you're a female. And one other thing, I said the BMI, and you have dark splotches, they call them skin tags. They're actually called acanthos nigricans. It's dark spots. So And there are definitely other symptoms, but these are some you want to look at. So if you are interested in learning more about how to reverse your insulin, how to cure your, how to reverse your diabetes, your type 2 diabetes. Now, I'm not talking about type 1, although there's some good things on the horizon about that. Then join my program. I see some people on here that have joined that are definitely diabetic, and they're gonna help themselves. Okay, you got to get the sugar out of your body, and you know, that sugar that you eat, even though you pump in that insulin, the damage to your eyes, your kidneys is already done before you pump that insulin or hit that pump or take that shot. It's already been deposited. That's why when you check your sugar right after you eat, if you were to put a peppermint in your mouth and you check your sugar right in the tip of your finger, you put the peppermint in your mouth, but you checked your sugar on your finger, it would be elevated. Okay, and that's because that's how fast that sugar gets to your bloodstream. It goes to the capillaries in your eyes, it goes to your kidneys, it goes to your organs, it goes to your feet, it goes everywhere. Yeah. So HDL is your cholesterol, Hugh. Yeah, HDL is your healthy cholesterol. LDL, yeah, okay. So you want that to be above 40 or 50, okay? There's HDL and LDL. There's not two kinds of cholesterol. Those are just the carriers that transport. I did a webinar on just a couple of days ago on cholesterol, so you might want to go back and watch that. Okay. All right. I think I'm done. Tomorrow night we're going to talk more about diabetes. I'm going to talk about intermittent fasting and ketosis. Probably ketosis tomorrow night, intermittent fasting maybe the next night. But thanks for joining me. Please share this video. There are people that literally are dying to hear it. They literally are dying. They have metabolic syndrome, which is high blood pressure. You know, diabetes causes so many diseases. It really does. I mean, I see it every day in the nursing home. I saw 4 patients today in the nursing home, and they had, oh my gosh, this one lady, she wasn't obese, but she had ulcers on her feet and on her legs. And then I had another man that was severely obese, and he's been in the hospital for weeks, and now he's come to the nursing home to kind of get rehabilitated to go back home. But, you know, I hope that someone has taught him what to eat to help himself, So thanks for joining me, and we'll see you tomorrow night.